my name is Brittany. I am a physical therapist assistant at Innovative PT Solutions here in Watertown, New York. I am also a certified personal trainer through NASM, the National Academy of Sports Medicine, and I want to show you a video on just some stretches that you can do after having a total knee replacement. So if you have had your knee replaced, whether it's a partial replacement or a total replacement, for the first few weeks it's tough. There's a lot of stretching that's going to be happening both in the clinic and out of the clinic. So I want to show you the stretches that you should be doing outside of the clinic at home, depending on whatever your physical therapist and surgeon have talked about as far as repetitions and kind of the frequency throughout the day. So I'm going to show you these stretches using a dog leash, and then I have two decorative pillows that you can grab, or if you have, sometimes they make like this more dense, like a foam roller type deal, you can use that as well. Alright, you can do these laying down on your bed. So I'm going to show you here. One of the most important exercises after a total knee replacement is the quad set. So you're going to straighten your leg, and then you want to press that knee down towards the bed. Hold it there for 5 seconds and then relax. If you would like, you can prop up onto your elbows and you can actually watch the quad muscle contract, or actually hold the quad muscle so you can get that mind-muscle connection as well. So you're here, press down, hold, and relax. We're going to do 10 of those. So that's 3, 4, here's 5, 6, 7, 8, 9, 10. Now, you can do that on both legs at the same time. You don't have to have one leg up, although that is the most comfortable position if you're laying down flat, because it takes some of the pressure off of your lower back. So the quad set is one of the most important exercises after having your knee replaced. That is also going to give you an extension stretch. So if you have kind of mastered that and your knee is all the way down and it's touching, or your calf muscle gets in the way where you can't actually push all the way down, take either a small pillow like this, or roll up a couple towels and put it underneath your ankle. And sometimes just propping that ankle up, you will get a really deep stretch on the back of your leg, right behind the knee. And you can also do that into a quad set too. So propping your ankle up, pressing down, contracting that quad, and getting a stretch on the back of your leg into knee extension. A really good way. You can do a set flat and then a set with the ankle propped up. Alright. Next, we're going to go into flexion. So, taking that dog leash, loop that right around your foot. You can have it on the inside or the outside of your knee. See what feels best for you. This one you will be laying completely flat for. And then you're just going to pull up. Get a nice good stretch in that knee. Hold it there for a little bit. And then slide it back out. You can use a little towel or something underneath your heel to allow it to slide better. It should slide fairly easily on top of your blankets or your sheets in bed. Coming all the way up. Using your hands to help get a little bit extra stretch and then relaxing it all the way down. All the way up. Work into a stretch. Hold it there for a little bit and then take it a little bit further. There we go. Let's do a couple more. I'm going to show you on the outside again. Try to keep your leg in good alignment. Don't let it come in or go out. So you want to keep that knee straight up towards the ceiling when you're doing this exercise. So just keep watch of that. Pulling all the way up, getting a nice good stretch, holding it there for about 5 seconds and then maybe pushing a little bit more. And you want to keep your hips nice and level. Don't arch your back, don't contort your body. And the first few repetitions you may have to work into a little bit, and that's okay. And then get really good stretches after that, okay? Keeping it on that same foot, you can flip over. Make sure your incision is nice and healed, because sometimes putting pressure on that before it has healed enough will be really irritating. We don't want anything to happen to that. So double check with your physical therapist before doing this next exercise. And you're going to lay on your belly. I kept that hooked right around my foot as I flipped over. And then what you're going to do, drape that right over top of your shoulder and then bend it up this way. Get a nice good stretch and then relax it down. You can do this stretch so you get flexion, but if you hang your leg off of the bed, so your lower leg is actually off of the bed, you'll get a nice extension stretch too. So pulling it all the way down and then letting it hang for a little bit into extension and then pulling it all the way up into flexion. So you're getting both motions there. Again, make sure it's been cleared by your physical therapist before starting this, because you don't want to burst open any of those stitches, or if you had staples or glue, you don't want anything to happen to that incision. Alright. I'm going to show you an exercise for the quad muscle again to help strengthen that. This time I'm just going to use this little decorative pillow. It's pretty stable, or firm I should say. So if you get something too soft, you might just push it down and squish it so your leg isn't actually off of the bed. So kind of find what works around your house. This is one, if you have a foam roller, that would be perfect to put underneath here. And again, I'm bending up my other leg just to take some pressure off of my lower back. And from here, you're going to just lift that lower leg up, tighten the quad, and relax back down. Up, tighten that quad, relax down. Hold it for about 5 seconds if you can. And the goal for each of these is about 10 repetitions, unless otherwise instructed. 10 repetitions, holding for about 5 seconds each. And that goes for the one with the dog leash that I just did as well. And when I talk, I lose complete track of counting, so let's do one more. Good job. You can slide that out. Throughout the day, all the time, you want to keep on doing ankle pumps. So you can twirl them in circles, go up and down like gas pedals, anything to keep your ankles moving. That's going to prevent blood clots from forming in the calf area. Just a really good way to keep that circulation, and it should help with some of the swelling as well to get that fluid work back up and out of your system. So ankle pumps all the time. You're always, always, always moving your ankles to prevent blood clots from forming. All right. I'm gonna show you a glute set next. So you're gonna be laying down, you can lay down flat, and you're gonna tighten those butt muscles. So you're gonna tighten, hold, relax. You might feel your pelvis lift a little bit while you do that, and that is okay. You're tightening your butt muscles together, holding that there, and then relaxing. This is called a glute set. It's just good to keep those other muscles functioning and working and activated throughout this. It is a long journey, but it's a great journey because you will feel better in the end. First few weeks are tough and tricky and painful, but it is all worth it in the end. And you'll like us physical therapists by the end of it too. And one more. Good. And again, I was holding that for about 5 seconds as well. Going into about 10 repetitions is a good goal for that. All right. Next, I'm going to show you in a sitting position a couple exercises. I'm going to switch. I just showed you all of those exercises on my left leg. Now I'm going to show you it as if I had a knee replacement on my right leg so you can see a little bit better in the camera. Alright, so the first thing is going to be into that flexion. You're going to take your heel and drag it back towards you. If you have a chair that's open underneath, that's going to work best. You can do this on your couch, but using a chair with that opening is going to be a little bit easier for you. And then coming back out. All the way back and back forward. If you're getting to the point where you're all the way back as far as you can go, that's okay. Take your other leg, cross your ankle over top, give yourself a little extra push there, and that will give you a little bit more of a stretch. And then take it out. And if you need some help, take that other foot, hook it back behind, and push it back forward. Alright, so you can use that other leg to assist you in this one as well. Going back and back forward. Getting a nice good stretch, holding it there, seeing if you can get a little bit further, and then allow it to relax back out. So that would be into a flexion stretch. I'm going to show you another quad strengthening exercise. You're going to come up into a longer quad, so you're just kicking your leg up, getting a nice good contraction in that quad. You can feel it right there, you can see it, and you want to work those muscles. If you have the balance, or using the back of the chair, you can come up and use the other leg to help get a little extra extension. So you're coming up, and if you lack a little bit, see if there's a little bend in my knee. Little bit, you're still not completely straight, but that's contracting. Take that other leg, lift it up a little bit more. Alright, so you can go help a little bit into that extension and do that. Alright. I believe I showed you a good start to your home exercise program after a total knee replacement. Your therapist might have other exercises, but these are the fundamentals. These are the ones you have to do all the time. Lots of stretching, Put some ice on it after, cool it down. It's gonna get inflamed, it's gonna get swollen. If you have any streaking redness, severe warmth to it, excessive pain, anything like that, make sure you tell your physical therapist and your surgeon, and then go from there. We don't want anything to happen, and the first few like I said, the first few weeks are really tough, but it's okay because towards the end of it, you will be so happy that you did this. If you have any questions or anything, you can always give your therapist a call or your surgeon. It would probably be easiest if you got a hold of your therapist first. So if you have any questions, please do not hesitate. Have someone with you, have someone help you with these if you need it, and always listen to what your therapist has to say. Alright, bye guys, thanks!